Yeah, this is a retrospective study. It was a kind of like a Florida-based consortium and Caribbean with Puerto Rico. I think we our colleagues wanted to bring up the results, preliminary results of bispecific antibodies in the real life or real world era. So I think the important thing to remark here is a study that was included sites that didn't have prior experience with bispecific antibodies in trials. That's kind of like probably the most novel part. And we enrolled close to 100 patients, about 80 to 90 patients that they were kind of like a half-half glofitamab and epcoritamab, mostly epcoritamab because epco was approved earlier. We saw actually similar responses that is being reported in the clinical trials, but also we discovered, there were few findings that we discovered. One, the patients who are CAR-T refractory, they are the ones that don't respond very well to bispecifics. And we think that the reason for that is that probably there is a shared mechanism of resistance between CAR-T and bispecific antibodies that may have to do with the tumor microenvironment or inflammatory milieu in the lymphoma that makes the T cells less infiltrated into the tumors or into the lymphoma, into the lymph nodes. So I think it's valuable to have this real life data so we can communicate we can tell to the community that bispecifics are showing the responses that they've shown in the pivotal studies. So we were very excited to show that to the community.